Okay, good afternoon, everyone. I'm speaking to you here this afternoon on Blackfoot territory, and I acknowledge the Métis people who share a deep connection with this land. I'm joined today, I'm so glad to be joined today by my friend and colleague Janis Irwin, the Alberta NDP Critic for Women and 2S LGBTQ2S Issues, and Vicky Todd and Alex Kramer, who are both birth doulas here in Lethbridge. Now, despite what Danielle Smith and her UCP candidates claim, there is a crisis in healthcare affecting every community across Alberta. We all know that the UCP began their time in government with waging war on doctors. Right before the pandemic, they tore up their contract, cut their pay, bullied them online and in person on their driveways, and forced them to take on mountains of new paperwork just as the pandemic began in Alberta. And as a result, over the past 3.5 years, many doctors have left the province, or they have retired early, or they have left the profession. This ongoing crisis has significantly affected our city, leaving only 1 in 3 people in Lethbridge without a family doctor. And perhaps even more concerning, we right now only have 1 OB/GYN serving our entire city of 100,000 people. This crisis also continues to affect communities surrounding Lethbridge, where staffing shortages have forced temporary closures of many emergency rooms. That unsustainable workload and stress on rural physicians has affected communities like Pincher Creek, where the area's only surgeon says he can no longer support ongoing labor and delivery in his community beyond May 31st. The UCP's failure in healthcare continues to force pregnant people to drive hundreds of kilometers to receive care. Danielle Smith and the UCP's flagrant disregard for women's health should be a concern for all Albertans. This frightening shortage of obstetric and birthing care in Lethbridge and our surrounding communities caused by the UCP cannot continue. We have got to get to work on the physician and healthcare team shortage, and we have to expand reproductive and women's healthcare choices here in Lethbridge. And for more on that, I'd like to turn things over to Vicky Todd.
Thanks, Shannon. Since October, our community has faced a concerning situation. We've been operating with only 1 OB/GYN in a hospital that serves over 100,000 people. Last year at this time, there were 7 OB/GYNs in this community. We simply need more care providers to safely address reproductive health in our community. People are worried. They're worried because when their birth control prescription runs out, they don't have a family doctor to refill it. They can't socially or financially afford an unplanned pregnancy. People are worried because they don't have a family doctor to provide them a routine pap test, which is the first step in diagnosing early stage ovarian and uterine cancer. For the folks who are desperate to conceive a baby, they are worried because they're being told the wait to see an OB/GYN could be 1 or 2 years, which could feel like an eternity after spending more than a year or longer trying to conceive. Their dreams for parenthood are falling further away than ever. Folks are worried they'll be transferred to Calgary or further for prenatal care or to give birth to their babies. And for the parents about to give birth, they're going through a revolving door of doctors. While the nurses and physicians we have here on the ground, including locum resources who are traveling in to assist, are doing the best they can to fill the gaps, we know that continuity of care is critical to building relationships with care providers. Families need and deserve consistent care. This consistency builds trust and safety in situations like these: infertility, reproductive cancer, pregnancy, and some of the most impactful and vulnerable medical moments in our lives. We need more doctors, more midwives, more specialists to ease the load and create safe and reliable access to care for conception, birth, and beyond. As Shannon said, we're also really nervous about what's happening over in Pincher Creek. It has been increasingly difficult to get answers about what's happening beyond May. Right now, it appears from what we are hearing in the community that access to labor and delivery in Pincher Creek after May could be stopped entirely. This is forcing families to plan ahead, that they will have to travel to Fernie, which is out of province, or to Lethbridge. And the lack of clarity is causing even more stress for folks who are expecting babies. It's time to take action and offer incentives for more OB/GYN physicians not only to come to Alberta, but to stay here in our community.
Thank you, Vicki, and thank you for advocating for Lethbridge families and all you do. I'll now like to ask Alex Kramer to say a few words.
Thank you, Shannon and Oki. Free contraception is a step forward for reproductive justice and for equity. There are many people who have coverage for contraception through extended health plans, but there are many who cannot afford these health plans or do not have access to them. Access for all is a win for everyone. There should be equity for all people who menstruate, not just the ones who can afford it or who have a job that provides it. It's also not just a physician who can prescribe and insert contraception. It is also within a midwife's scope of practice to prescribe birth control and insert IUDs. Expanding midwifery care expands access to contraception. Access to contraception is a right, and free contraception allows women to have the autonomy if and when they choose to have a family. It alleviates the burden of the cost on people who menstruate, and it frees up money for families who already have sky-high expenses for young children.
Thank you, Alex. Thank you for being here today and for all you do to support women and pregnant families in this community. Now, Danielle Smith and the UCP are not focused on ending the crisis in healthcare in this province. They are consumed by their plans to privatize and dismantle our public healthcare system. I can promise that an Alberta NDP government will be focused on what matters to Alberta families. We'll end the crisis in healthcare. Our recent released family health team strategy will fix that crisis in healthcare with respect to primary care. Developed in consultation with healthcare workers and others on the front lines, our plan includes recommendations to integrate primary care with community and social services and provide more extensive mental health care. And that team-based approach will provide comprehensive health care to all Albertans. I'd now like to turn things over to Janis Irwin.
Thank you so much, Shannon, for hosting me here, and thank you to Alex and Vicki. So, just a few weeks ago, on International Women's Day, in fact, Shannon and I were very proud to stand alongside our Alberta NDP Women MLAs as our leader, Rachel Notley, promised that should we, the Alberta NDP, form the next government, we will offer universal access to free prescription contraception across the province. And a recent poll showed that nearly 3/4 of all Albertans support free prescription contraception. But Danielle Smith and the UCP have refused to consider this life-changing policy, with the Premier brushing it aside by saying that a vast majority of prescription drugs are already covered under private plans. Well, we know that that is simply not true. Many Albertans cannot afford private insurance plans. Last week, in fact, I was joined at a press conference by 4 incredible young resident physicians, all of whom are training in obstetrics and gynecology, and all of whom are passionate about advocating for their patients. And Dr. Ariane Letalien, she said that cost influences decisions that Albertans make about birth control every day. She said that the most effective forms of contraception, like the hormonal IUD and the contraceptive implant, are also the most expensive to purchase up front. So when patients are told that they will have to pay more than $400 out of pocket for an IUD, Dr. Letalien said that some patients understandably turn to cheaper forms of birth control, even if they're known to be less effective or to have more side effects. And she said, and I quote, "It's unfair, it's frankly heartbreaking to see as a doctor. Albertans deserve the type of birth control that's right for them, not just the one that they can afford." Dr. Letalien also pointed out that from a purely economic perspective, universal access to prescription contraception makes sense. Unplanned pregnancies are expensive. Delivering a baby in the hospital can cost, to the public system, up to $5,000 for vaginal delivery and up to $10,000 for a C-section. And based on the cost of a similar program in BC, the total cost of the coverage that we're proposing would be around $33 million a year. In addition to BC, we've seen this type of coverage in Australia, New Zealand, the UK, and Scandinavian countries. So we, the Alberta NDP, will make this coverage available in Alberta, and that's our commitment to all of you.
Well, thank you, Janis. And it's very, very clear to people in Lethbridge that we have a healthcare crisis, particularly for women. And not only will the NDP actually take that crisis head on and solve it, through our proposal with family health care teams with better conditions for recruiting, attracting, and retaining doctors across the province, but also through expanding women's access to reproductive health care by making contraception free. We will ensure that families in Lethbridge can access a family doctor. We will ensure that a comprehensive healthcare plan includes access to free contraception. Thank you, and we'll now take your questions.
We'll go to questions in person.
Just to start out here, obviously a lot has been made about there only being one OBGYN here in Lethbridge. So just what is the NDP plan to attract more OBGYNs to Lethbridge, and what is sort of a target number to have here locally?
Well, I think that would be up to folks within AHS to give us good advice on that. But as Vicky said, last year at this time we had 7 OBGYNs, and now we have 1, and potentially 1 returning from maternity leave in a couple of months' time. I hear from people pretty well every time I go out canvassing about this crisis. And I don't just hear about it from expectant families. I hear from people who have just had to go through a miscarriage and didn't get the right care because they simply could not access it. I hear from people who are waiting years for a hysterectomy. I hear from people whose treatment around uterine cancer has to take place out of Calgary. This is a serious crisis. It needs to be taken seriously. What we cannot have is a UCP government that is distracted by its own premier that cannot go a day without an unhelpful distraction or an unpredictable outburst of some kind, who is just simply looking people in Lethbridge in the eye, and people are not buying it, that health care is somehow magically fixed. It is not. What we need is a credible, thoughtful plan. It starts with family health care teams so that we can make sure that people have that primary care center of care, whether it is a family health care physician, whether it's an OBGYN, whether it is a physician's assistant potentially, or a nurse practitioner, or birth doulas and midwives, all practicing to be able to deliver that primary health care. We will get one of those clinics should an NDP government, or should the NDP form government here in Lethbridge. And the only thing I'll add is that we need to make sure that we've got an agreement with doctors that is based on respect and predictability. They've gotten neither from the UCP.
Do you have a follow-up?
No, I'm good, thanks.
Any other questions?
So we talked about, Vicky mentioned incentives for doctors, something that you'd like to see. We also have an election coming up next month. Should the NDP form government, what can we talk about what some of those incentives might be?
Sure. Well, in our family health care team's proposal, first of all, it would be backed by funds, but we would have specialized clinics. And Rachel Notley has made a commitment to 10 clinics across the province. And Rob Miyashiro and I have made that commitment subsequent to that, saying one would be here in Lethbridge. That is part of a solution. But another part of the solution is those residents that Janis was doing a news conference with last week, is to make sure that we have a predictable and sustainable physician agreement where they can see their future and practicing in a healthcare system that is not subject to the whims or privatization winds that Danielle Smith seems to be following. That is not the way to compete with some of the physician agreements that we're seeing coming out of British Columbia or elsewhere, where doctors are finding that they are going to take up their residency there because they have a more predictable, respectful relationship with the province.
Any follow-up? With no questions on the line, we will wrap today. Thanks, folks.
Thank you.
Thank you.